Good morning, everyone. Thanks so much for joining us here on KXAN Live. I'm Will Dupree. We are about to carry a stream here in just a moment. As you can see right there, an update on district operations from the Austin Independent School District. The superintendent, Dr. Stephanie Elizalde, will be talking about the return from winter break, and we got an indication about what she's going to discuss just a few moments ago. Our newsroom received an email that she sent out today to families within Austin ISD. And I'm just going to look over here to this other screen so that I can read off what it says exactly. She writes that, quote, "I am writing to confirm that next week we will resume operations as planned for spring 2021, with the exception of extracurricular activities. Only varsity sports will continue. All other extracurricular activities will be suspended." Two big things there. Classes are going to resume as planned the week of January 4th. I believe students will be back on January 6th. However, all extracurricular activities will be suspended except for varsity sports. Her letter goes on to say, quote, "As an essential service, Austin ISD will resume on-campus instruction for those who choose it the week of January 4th. We will also continue to offer remote instruction for families for the remainder of the school year, and if a family wants to transition their children from on-campus to remote instruction, we will make the change upon request." It goes on to say that we will be taking advantage of the TEA's, the Texas Education Agency's allowance, to offer asynchronous learning. In Austin ISD, all learning activities will be virtual on the following Fridays: January 29th, February 26th, March 5th, and April 9th. Dr. Stephanie Elizalde noting here, please take a moment to mark these dates on your calendars. We just got this notification from the superintendent of Austin Independent School District, so we're working to put that all in a web story over on our website, kxan.com, so you can read a little bit more there. We are, though, going to hear from her here in just a few moments of this press conference getting underway virtually to discuss the return from winter break. And now we know that classes will resume. However, extracurriculars will be suspended except for varsity sports. And then there are a few Fridays during this spring semester where people will be doing asynchronous learning, the district taking advantage of the Texas Education Agency's allowance to do those very things. So again, this is a lot to follow along today. We are just getting this information within the last few minutes. We are awaiting this news conference here shortly to begin. So we thank you all for joining us here as we track this. A few things, though, to put this all into context, why this particular news conference is so needed right now is that Austin-Travis County is in a pretty dire situation with its COVID-19 cases, as well as hospitalizations and ICU admissions. If you take a look right here, I've been trying to keep track of the numbers that Austin Public Health has been reporting and sharing out there regarding those particular numbers and statistics. And if you take a look, here's where the situation stands right now in Travis County. We now have 4,729 active cases of COVID-19, and pointing out as well that since the pandemic began, we have now surpassed 50,000 total cases. This is dating back to March, obviously, but that grim milestone being hit yesterday and reported and confirmed by Austin Public Health. We also have had 548 people die from COVID-19. Fortunately, though, almost 45,000 people have now recovered from it after becoming infected. A big measure that many of the doctors and health experts in our area have also been warning about is in that right-hand column there. 434 people are currently hospitalized in Travis County because of COVID-19. 140 have been admitted to the intensive care units. And finally, 81 people now require machines to help them breathe after getting COVID-19. Point out there, this is a record amount of active cases for our area, the most since the pandemic began. And also, this is a record in terms of new hospital admissions, 79 in the last day. So please stay with us for just a little bit longer. This news conference should be getting underway any moment now. Again, this is from Austin Independent School District. We're going to hear from the superintendent, Dr. Stephanie Elizalde, about the return from winter break. That happens next week. Classes are set to begin again for students on January 6th. What we do know is that the superintendent has sent out a letter to families whose students go to Austin ISD schools. And she is saying that classes will resume on-campus instruction during next week when the session begins again. And she will also says that the district will continue to offer remote instruction for families for the remainder of the school year, and if a family wants to transition their children from on-campus to remote instruction, she says, quote, "We will make the changes upon request." So please bear with us just a little while longer as we continue to await this particular news conference to begin. We appreciate you all joining us. I'm Will Dupree. Again, we will have all this information compiled for you in an article on our website. That's kxan.com. You can also download our KXAN News app and access all that same information too. For now, I'm going to leave up the slate there that you see that says Update on District Operations. This is to let us know that that news conference is about to begin. So again, stay with us for a little while longer as we await remarks from the Austin ISD Superintendent, Dr. Stephanie Elizalde.
We are here this morning with our superintendent, Dr. Stephanie Elizalde, who's going to give us an update on our district operations for next week. So just a little bit about how this will work. We'll have everyone type in a question. We have 11 outlets RSVP'd, so we'll go down the list and one question each round. So I just typed in the chat how you can format it to make sure that we can read it exactly as you wrote it and identify you properly. A recording of this in English and Spanish will be available later today on AISD TV. And I think with that, I'm going to pass it over to Dr. Elizalde for some opening remarks.
Well, good morning, Austin ISD community. First, of course, I hope that you are having a restful and joyous break with those in your household, as has been recommended for all of us. And hopefully you're also finding some creative ways to celebrate this very unusual season that we're in, and maybe even utilizing some virtual settings in connecting with other members of your family and friends. I know that there have been a lot of questions regarding our return to our schools with our staff development beginning on January the 4th, and students at most of our campuses set to return January the 5th. And as we have continued to examine and work on our contact tracing data and continue to consult with Austin Public Health, I want to reaffirm that, as everyone knows, education is an essential service, and Austin ISD will resume on-campus instruction for those who choose to utilize our on-campus instructional delivery beginning the week of January the 4th, with instruction actually beginning January the 5th. We will also continue, as I've stated many times before, but want to reiterate, we will continue to offer remote instruction also for our families who choose to do that as well. If a family is wanting to transition from on-campus to remote instruction, that can be done easily and in the immediate time frame. So if at the end of our first semester, your son or daughter closed the year on campus and you would choose to go remote starting January the 5th, don't have any concerns at all. We will be able to transition that effective immediately starting on January the 5th if you so chose to do so. Now, I would like to reiterate the fact that I think the Austin Chronicle probably wrote it the best, certainly better than I could. We are between a rock and a hard place. There is no agreement, even amongst physicians or experts. There's no agreement between parental philosophies. There's no agreement between different constituencies that we have. So this is a very difficult place, of course, to be, because we do not at any time, our goal is always to want our community to be very satisfied with the decisions that we make. There are also constraints, and those constraints absolutely come from the Texas Education Agency. However, being that school is an essential function, we know that some of our parents also have a requirement of needing their son or daughters to be in a school setting environment physically, not just remote or virtual. So the majority, the large majority of our families are in fact choosing to go remote, and we want to continue to encourage that. That being said, in order for us to maintain our funding, it is required that we have on-campus instruction also available. I'm going to pause for just a moment because I'm having a small technical difficulty. Give me one moment, please.
We'll return with Dr. Elizalde's remarks here in just a moment whenever that technical issue has been resolved.
My apologies.
And she's
We
back.
were about
Take a listen.
to lose power to this computer, so I thought it was necessary that I take care of that. So continuing on, knowing that, of course, this is, of course, also related to funding, and it is a requirement. We also know that it is most important to recognize, again, the majority of our parents have in fact chosen remote, and we want to continue to encourage that as an option for those who choose so. So the decision is based on multiple factors. One, we have been far below the threshold. So even in looking at stage 5, either at 50% capacity as being recommended, or even at 25%. Our secondary schools have been at around 18% or below in attendance, and that was prior to us being in stage 5. Our survey revealed that many of our parents would select to keep more of their children at home if we went to stage 5. So I even anticipate that the number of students that would be reporting on campus will be even less than the 18%. We are continuing to commit to you that we will do our very best in maintaining as healthy and safe an environment as possible. We will continue with all of our protocols. We will continue with all of our screening. We have even added additional measures such as plexiglass in many of our elementary classrooms. And we also have to reiterate that our data on our campuses still is supportive of the fact that we have been able to keep our contact tracing very close to individuals who have been positive. And so that means we have not seen, outside of the immediate contact tracing, we have not seen that type of spread in our schools. Now, I also want to reiterate that I can take full advantage of the fact that if we have any concerns at any of our schools, we can close down a classroom, a wing, or an entire school for up to 14 days. And I want to reassure you that if that is necessary, we will utilize that effective as soon as we have any concerns. We'll continue to also recommend that any of our staff members or students elect to get testing, as we have those rapid COVID tests available. And they've been a little underutilized at this point. And now I would really encourage us to make use of the fact that we have access to that. In addition to that, we have suspended extracurricular activities with one exception, and that exception is with regard to varsity activities. And that is because many of our students and their parents have talked with us about scholarship opportunities and the fact that they would be missing out, as the University Interscholastic League has still not allowed us to simply suspend or postpone games. UIL is still requiring these games be played. Otherwise, we forfeit, and our students would not be able to access some of the opportunities that could be available to them for post-high school situations. So with that said, we also know we have an outstanding team of nurses on our campuses, and they've done a great job of continuing to work with us in terms of our contact tracing. And then lastly, there is light at the end of the tunnel, but that tunnel is still very far away, as we all know. We have to continue to practice safe practices, and we must continue to minimize our contacts with individuals wherever possible. So we're going to continue to monitor the situation, and all of the surrounding school districts are also continuing to have on-campus instruction available. So there have been questions around some of the other options that could have been available. Some of them may come up in the questions that we have after this, but one that I probably want to highlight is closing completely really puts us in a situation of having to go into June, and that causes additional situations for constituents. But depending upon how long that closure would last, we would not be able to make up the time within the June 30th deadline. That is a requirement also under the TEA requirements of funding. Teacher contracts also have to end prior to June 30th. So we would not be able to extend those days into the June month. So I know that no decision is going to create harmony amongst our constituents. We are continuing to do the very best we can with the data that is available to us. And again, I want to reiterate, at any moment that a school is showing that we have some concerns, we will absolutely access our ability to close that school as necessary. And I'll be happy to take some questions at this time.
Thank you, Dr. Elizalde. Our first one on the list is Report Day Austin, but I haven't seen anything come through. So I'm going to move to the Austin American Statesman with Hojin Choi. His question is, at this point in the school year, how much of the 75,600 operational minutes required for state funding has the Austin School District achieved?
Ooh, we would certainly be able to get you that information, but I don't have it off the top of my head. I do know that we are below the 50% mark of that requirement because we did not have enough number of days in the first semester to meet the 50% point. But I'll extend to that question the fact that if we went 100% remote, and I'm sure everyone knows this, but I'm going to repeat it anyway. If we went 100% remote, the challenge is that we only get 50% credit for that time, and it can also still impact additional funding. And so that would mean we would still have to make up days. And as we surveyed both our families and our staff, the information about having to do Saturdays or giving up spring break or adding even more minutes onto the school day than we already have, and then going into June has just resonated with individuals about how challenging this school year has been, and making it even longer, whether we agree or disagree with the fact that is the position the Texas Education Agency has at this point, which is we will only get up to 50% credit for going 100% remote.
Perfect. Okay, our next question is from KView from Daranesha Heron. Have Austin ISD nurses received the COVID-19 vaccine, and when will teachers and other staff receive the vaccine?
Yeah, we really need help with that. I do believe some of our nurses, there is a certain percentage of our nurses who have already received the vaccine as being first responders. We're continuing to work with our nurses and with Ascension to see if we can get them also trained so that we might be able to leverage the ability to provide vaccines for our staff once that becomes available. Unfortunately, while the federal government put teachers in 1B, they did leave it up to the states to decide whether teachers stayed there or not. And unfortunately in Texas, they've elected not to have us educators, teachers in 1B. We would love for people to continue to ask our state to reinstate teachers into 1B so that they would be able to have access to the vaccine. Now, it is available to anyone, which does include some of our staff, if they are 65 years of age or older, or if they have certain pre-existing medical conditions of any age. So I would encourage everyone to look at the literature regarding 1B and accessibility then to receiving the vaccine, if at all possible.
Great. Our next question is from KUT. Claire McInerney is asking, how long are extracurricular activities suspended for?
Right now, it's indefinitely. Certainly while we're in stage 5, I'm going to maintain that suspension. So I do not see us removing that at any moment unless we are no longer in stage 5.
Perfect. Our next question is from Beth Sullivan with the Austin Chronicle. Do you have any comment on Education Austin filing grievances on behalf of teachers denied accommodation requests for this spring?
I would want to simply state that there is absolutely a reason why those processes exist, and we want everyone to access the processes as they feel necessary. And in the meantime, I would want to encourage them to continue to work with us to see if in the meantime we can find some a different type of variety of accommodation that might be satisfactory to them.
Thank you. La siguiente pregunta viene de Nayeli Santoyo con Univision Austin. Háblanos sobre el plan que el distrito escolar decidió para el regreso de clases de los estudiantes después de sus vacaciones de invierno.
Pues es importante que reconocemos que somos importantes para las familias. Entonces, como la mayoría de las familias están escogiendo la educación virtual, tenemos un pequeño porcentaje de alumnos que están asistiendo a la escuela en persona. Así es que es importante recibir los fondos de la Agencia del Estado de Educación, y entonces es la manera que podamos seguir sirviendo a los alumnos y al mismo tiempo no estar en una manera difícil con el Estado, que a lo mejor no podemos recibir fondos.
Thank you. So our next two outlets are CBS and Fox. I haven't seen anything come through, so I'm going to move to community impact. CBS and Fox, if you do have something, feel free to drop it in the chat. Okay, so community impact is asking, what is being done in the spring to track student achievement? For example, will comparisons be done between on and off-campus students?
I'm sorry, will you repeat the last part again? Are we talking about students that are virtual versus those that are on campus?
Correct, yes. I believe that's what they're aiming for. So tracking student achievement between on remote and on campus.
Well, certainly we have student grades that are available to us, and that's an indication of, you know, the teacher's assessment of how students are doing. So we can always review grades to provide us an indication. And we have seen some students, obviously, who may not be doing very well in a virtual setting. There is never going to be, nor do I want there to ever be, a substitute for our teachers in person. However, there are some students that we have found have benefited from a complete remote or virtual situation. I think this has allowed us an opportunity to think about how we truly can offer virtual instruction to some of our students once this era ends, and do so in a way that would be more proactive. So we'll continue to monitor how students are doing through their grades. And we do also have some requirements of some assessments. We have minimized those in our district. We don't want to get so focused on the fact that there is a huge mental health component to this school year. And we want to ensure that we do not, that we don't value and stay focused on that has to, our health and safety does have to come in the forefront, even in front of our achievement.
Great, thank you. Again, I'm not seeing anything from Spectrum News, who is next, but we will move on to KXAN with Jody Barr. The question is, since we're back in stage 5, will teacher accommodation requests be reconsidered?
Unfortunately, the stage in which we were in was not a factor with regard to our decision making. As you may recall, the first issue is about the individual job and the individual responsibilities of the particular functions of that individual. That's the first area that is looked at. So at this time, we would not be revisiting those. However, I would encourage those who have received additional documentation that we don't have, if they would like to resubmit, we absolutely will revisit their individual circumstances if their circumstances have changed or if they have additional documentation for us.
Thank you so much. Okay, so that completes our first round. If anyone else has any secondary questions, feel free to drop them in the chat. I'll just go in order again. So the first one we've received is from KView. What new safety measures is the district adding since students will be going back to class while we are in stage 5?
Well, I think the important issue is that we know that the safety measures we had in place were quite successful. So we'll continue those, but we have added additional plexiglass in certain areas where the 6 feet might have been challenging. We're also going to continue to evaluate as we do get cases identified. We're going to ensure that contact tracing continues as we've done it in the first semester, but I may be accessing and being a little more aggressive on closures depending on the number of cases that we would find at a particular campus. I would also want to re-encourage us to access the rapid COVID tests that we do have available in Austin ISD at each and every one of our campuses. And I think those measures can help us both feel better, but not just feel, but know that we are free of the virus, or if I have the virus. So I want to encourage our staff to utilize our COVID rapid tests at each of our campuses.
Great. Our next question is from KUT. What is the status of the pilot program that allows campuses to create their own plan for which teachers are on campus? Will you allow more schools to create their plans so teachers feel safer?
Yes, we are going to be embarking on those plans starting on January the 5th. And as we see those roll out, we can certainly be looking for expansion of those as those show success, and that we can continue to meet the needs of the students. This would be an excellent opportunity, I think, with the fact that our surveys are demonstrating that fewer families will be choosing to have their students come to on-campus instruction. Would be a good opportunity for us to possibly scale these new individualized approaches that may allow some teachers some additional accommodations.
Great, thank you. So from KXAN, in a previous answer, you mentioned being more aggressive on school closures. Can you explain a little bit more about what that means specifically? Sure. Is there a line for those determinations?
Well, it's, thank you for that question. You may recall we closed Austin High School as an example for 3 days. We actually have the ability to close if we're concerned about the contact tracing. If I think, you know, if our staff says we haven't been able to do a good enough job, or we're concerned, as we were at Austin High, where we wanted to be reassured that this was in fact something having to do with a particular group of individuals rather than actual transmission within the school. However, we do have the ability to actually close a campus or a classroom for up to 14 days if there are concerns with contact tracing or with cases. And so what I'm indicating by that is to reassure our communities of safety, I will be looking at accessing that more often. Now, there are still some negative impacts to that. Again, the lack of notice to families, because if we do that, we're talking about having to do that just as the data appears. So it could be from one day to the next, where we would indicate we would need to close the school for up to 14 days. So I don't think that we have really utilized that. And definitely in stage 5, we're going to be looking at the numbers even far closer than we were during the first semester, and continuing to work with Austin Public Health. And if that's a recommendation that we close a school, it can be anywhere, again, from an individual classroom to a school, then we will be looking at utilizing that. And we haven't really done that. We certainly did it at Austin High, but even then we only did it for 3 days because we were very comfortable with the data we were getting. But I want to reassure our public that we can utilize that for up to 14 days.
Thank you. La siguiente pregunta es de Univisión. ¿Qué nuevas medidas de seguridad han implementado ahora que los maestros y estudiantes regresan después de 2 celebraciones grandes y bajo la etapa 5? Y el mensaje que tiene para los padres preocupados de este regreso.
Bueno, voy a comenzar con los padres. Es importante que los padres continúan a hacer las decisiones que ellos piensan son mejores para los niños de ellos. Y como vamos a continuar con instrucción virtual, pueden escoger eso a cualquier hora que ellos quieran usar eso. Y para los empleados, estamos usando todas las preocupaciones que usamos al principio, porque sabemos que fueron suficientes, pero también podemos asegurarles que tenemos los COVID tests que nos pueden dar información en 15 o 20 minutos sobre si estamos infectados. Los tenemos en cada escuela y queremos ofrecerlos a todos los empleados de las escuelas que los pueden usar, y los alumnos, los padres pueden también escoger que los alumnos toman ese COVID rapid test. Y continuamos a hacer decisiones usando información de los expertos en medicina, y estamos hablando con Austin Public Health cada semana, y vamos a continuar a hacer todas las preguntas del screening que tenemos antes de alguien que pueda atender o asistir a la escuela. Todo eso va a continuar.
Thank you, Dr. Elizalde. I'm not seeing any additional questions. I will give it about a little bit more, maybe a few more seconds, if anyone has any additional questions. Dr. Elizalde, I don't know if you'd want to give us any parting remarks now that you've received these questions.
I would just like to reiterate that as we come together as a leadership team and we make these decisions and we have these conversations, please keep in mind that at any given moment, right, depending on the perspective, we have some parents in our community who are very comfortable with the protocols that have been put in place, and they feel comfortable sending their students to school. And some of them, in fact, also need their students in school, both for academic, mental health reasons, or other reasons. And as public servants, we're wanting to meet that need. Then we have some parents who also feel that we should not have our schools open at all, and that we should only be going virtual, and that this isn't the direction to go. Then we have some staff members who feel like they need to have contact with their students. And then I have staff members, we have staff members that are extremely concerned about reporting in person. We know that depending upon the perspective, there are going to be a variety of different ways. This is so challenging because we don't even have agreement amongst the medical community. What I do know is that within stage 5, I'm going to work, we collectively as a team in Austin ISD are going to work very hard to, wherever possible, stay in line with the 25% capacity of attendance, which means that since we have far fewer students attending in person, we really don't have the gatherings that are being highly discouraged, of course. And then lastly is the overall challenge that we have, because there are certain things that I know some individuals say, well, even if TEA says that we shouldn't do it that way, just do it that way anyway. There are a lot of consequences, which include funding, which means payroll, which could have long-term impacts on the entire organization. We do not take any of these decisions lightly. It weighs very, very heavy on the fact that I know many people are going to be in complete disagreement with the manner in which we are continuing to keep our classrooms open for those who choose. But I'm going to continue to reiterate, we're going to do everything we can, as we did during the first semester, to be as safe as possible. And wherever we have concerns, we will not hesitate to close down a classroom or a school to ensure that we maintain healthy and safe environments for all of our staff members. And I do want to ask everyone to please contact individuals and ask them to put teachers on the 1B list so that they could be able to receive the vaccines within that first tier, if at all possible. And so I thank everyone. I would encourage everyone, what they can do to help their school is to continue to mask, to continue to stay in contact with just their household, and continue to use hand hygiene. The more we do that at home, the safer our communities are, which includes our schools. So I thank everyone for just working to try to make this the best situation possible. I know there are no right answers, and I ask everyone to just work with us and to recognize we are doing our very best. Thank you so much.
Thank you, Dr. Elizalde. And I'm not seeing any new questions, so this will conclude the press conference. I really appreciate everyone taking the time, especially on New Year's Eve, as we close out this year, to share this information with our families. So again, there will be a recording in both English and Spanish of this press conference on AIC TV later today if you want to share it out or pull any additional coverage. So I appreciate it. Thank you.
Thank you, everyone.
Thank you all for watching our stream from Austin ISD, and the superintendent, Dr. Stephanie Elizalde, answering some questions and providing remarks about classes resuming as scheduled next week. Staff members are to report back on January 4th, and students come back on January 5th. That's next Tuesday. Again, students will be allowed to do remote instruction if they so choose, and parents, as Dr. Elizalde said a few moments ago, can choose to make their kids go to remote learning if they are currently doing it in person, going to classes in person there. What she also said is that she's asking families out there to reach out to state leaders, including the governor, and ask those leaders to move teachers up to be among the first tier of those to receive the COVID-19 vaccine. Dr. Elizalde pointed out that federal guidelines say teachers should be like in that 1B category. So first, obviously, doctors, healthcare workers, nurses, those first responders there, but then just below that to be able to get the vaccine. The federal government is recommending that teachers be included in that category. However, Texas has not elected to do that. At this time, here in Texas in 1B are those people 65 and older and those 16 and older who have some sort of serious underlying health condition. And she's asking that people reach out to state leaders and demand that because while school nurses have been able to receive the COVID-19 vaccine so far within Austin ISD, teachers have not at this time. Dr. Elizalde did point out, though, that some staff members might fall into that age or health category that was just mentioned a few moments ago. So again, she's wanting people to be active and do that too. We have information over on our website about this in particular too, but Dr. Elizalde said that extracurricular activities, except for varsity sports, will be suspended indefinitely. And she pointed out that at least as long as Austin-Travis County remains in stage 5 of its COVID-19 risk level, that will be what the policy is. Austin moved to stage 5 on December 23rd, obviously the day before Christmas Eve, and extracurriculars will be suspended indefinitely except for varsity sports. That's the new announcement coming today from the Austin ISD superintendent. The superintendent also wanted to point out that she will be, quote, more aggressive when it comes to potentially closing down classrooms, wings of schools, or entire buildings themselves because of an outbreak of COVID-19. She said that the district has leeway to be able to do that kind of closure for 14 days, and she said that may be a possibility to utilize more during this particular semester. So we will, of course, have to wait and see what actions might be taken in the near future. If you would like to find out any information, including watching this video from the very beginning, we will post it in our web story on kxan.com, and you can also pull it up on the KXAN News app, so please download that. For now, I'm going to end our stream. Thank you all for watching. I'm Will Dupree here in the KXAN Live studio. We hope you all stay safe, stay healthy, and please take care of yourselves. We'll see you back here another time. Bye, everybody.